Okay, hypertension and RAAS. Hypertension. What is hypertension actually? So, a medical condition in which the heart pumps blood at a higher pressure against the blood vessels. That's what we're talking about. And then it can be simply be put as a blood pressure of diastolic higher than 140 millimeter mercury or systolic higher than 90 millimeter mercury or even both. So now talk about causes or risk of hypertension. One of them is high cholesterol level. We have diabetes mellitus, disease of other organs like pheochromocytoma, and we have age factor and family history. All this can precipitate hypertension, as you all know. Exactly. So, what are we going to look at? So, after looking at these causes of hypertension, we're going to be looking into another aspect of this today. Look at RAAS, that's renin-angiotensin-aldosterone system. Mechanism is angiotensinogen is converted to angiotensin 1 by renin, which is activated. Then angiotensin 1 is converted to angiotensin 2 by angiotensin converting enzyme, which is known as ACE. And then what does angiotensin 2 do? One, it will now cause release of aldosterone, vasoconstriction, release of ADH, and release of noradrenaline. Release of aldosterone from adrenal cortex, vasoconstriction, increasing total peripheral resistance, and release of ADH from posterior pituitary, and release of noradrenaline from adrenal medulla. All right, so these are the actions of angiotensin 2. So now, after angiotensin 2 has functioned, angiotensinase breaks it down. So what are the drugs used in the management of hypertension through RAAS mechanism? One, we're going to be looking at ACE inhibitors, angiotensin receptor blockers, diuretics, beta blockers, alpha blockers, and alpha and beta blockers. So in ACE inhibitors, we're concentrating on angiotensin converting enzyme, which converts angiotensin 1 to angiotensin 2. So a very good example of these drugs include enalapril and the rest. So we've got angiotensin receptor blockers. So the focus is on angiotensin receptor. We want these drugs to block this angiotensin receptor so that angiotensin 2 cannot bind to its receptors to bring about its effect. So we're looking at these drugs. We call them the Satan drugs. Satan drugs, losartan, valsartan, temsirtan, and the rest of it. So these are the drugs under there. We're looking at diuretics, drugs that increase urinary excretion or removal of water through urine. And so our concentration is aldosterone receptors, ADH receptors. So this particular group of drugs, they prevent the reabsorption of water or tubular reabsorption of water from the kidney tubules. So because of this, the water is passed out through urine. Examples include hydrochlorothiazide, spironolactone, and we have furosemide. So these are the diuretics. Some of them do. Now we have beta blockers. These are drugs that blocks noradrenaline from binding to its beta receptors. Example is propranolol, atenolol, metoprolol. So these receptors are found in the heart too. So these drugs block these receptors. We have alpha adrenergic receptors that are found on the blood vessels. So binding of this particular noradrenaline to these receptors will cause increase in total peripheral resistance. So examples of these drugs include prazosin, terazosin, and dozosine. So alpha plus beta blockers. These are drugs that block both the alpha and beta receptors on both heart and blood vessels. And examples of this particular group of drugs includes labetalol and carvedilol. Okay, so for today I think we're done. For more interesting medical videos, you can kindly subscribe, like, and hit notification bell. We'll be at your doorstep to deliver more better videos to you. Thank you and God bless you.